Hi everybody, I am Dr. Pradeep IC, addressing you from Amrita Center for Rheumatic Diseases, which is located opposite to KMC Art Tower in Mangalore. Last video, I have spoken about how to cope up with SLE. In that video, I had mentioned that those patients who are coping with SLE for the most of their lifetime, that is more than 20 to 25 years, I tell them to practice EAS second and third step. Second step is that surrendering to the higher power. Third step is that to make a decision to turn one's will and life over to the care of higher power as they understood it. So in this video, I will explain what are the higher powers regarding an SLE patient is concerned. First one is genes like PTPN22, STAT4, and the B cells, plasma cells, and the antibodies they produce like anti-SM, dsDNA, anti-Rho, anti-La, etc. and the immune complexes that these antibodies form with their corresponding antigen, and lastly the complement system what they activate. So knowing about this higher power will take away their guilt. Most of the patients feel guilty because they have lupus. Once they know that this is genetic in origin, they feel more comfortable and they know that this is nothing of their fault. This will help them to accept the treatment very promptly. Second higher power is the pharmacokinetics and the dynamics and the sensitivity of the receptors through which the drugs act. So once we tell them that the treatment results are not uniform for all the patients because these factors do exist. So this will help them to get adjusted with the ups and downs that usually happens with the treatment. So knowing these two higher powers will make their life comfortable. Among the literature, remission rate of lupus is less than 10%. So sometimes they ask, despite taking drugs for more than 5 to 6 years, this disease is not going away. Then I will tell them what Lord Krishna told us in Bhagavad Gita, Karmanye vadhigarasya ma phaleshu kadachana. That means you have no rights on the results of your deeds or efforts or karma. You have rights only on the deeds, efforts or the karma. Results I will give. So when we remind them, then again they are motivated to take the drugs and go on with their life. Then sometimes I tell them to join a group, that is SLE patients group. Then they will ask, Doctor, are you sending me to the group because misery likes company? I said, no. Just join the group and share your experiences, hope and strength. So when you share your experiences, hope and strength, you will develop enough strength to cope up with your weakness or overcome the weakness. This will make your life more comfortable. So this is a combination of science and spirituality. Of course, more of science and less of spirituality, but this amicable combination definitely helps the patients to go a long way. Thank you.